After the echocardiogram, there's usually more testing to really evaluate the severity of the problem and exactly what's going on. Those tests can include a lung scan test, which is a nuclear medicine test that just shows where blood is flowing and where it's not. And in addition, we often do a CAT scan, which shows the anatomy in a lot more detail of exactly how the blood is flowing back into the heart, and also shows the lungs and just the health of the lungs as well. But most of the time, the vast majority of time, in addition to all those non-invasive tests, we need to do a cardiac catheterization and actually measure the blood flow in the veins, the pressure in the veins, and look in a very detailed way of exactly how and where they're blocked. In order to treat them using the catheter techniques, that's one way. But most of the time, at least initially, we also recommend doing surgery on the veins. So all those testing is needed to really plan the surgery and to know exactly how bad the problem is.
Surgery for pulmonary vein stenosis consists of several important parts. But before surgery, we really have to understand the disease process within each individual vein. And for that, there are a number of studies such as cardiac catheterization and CT scan and lung scanning that are important to help define that disease. And once we understand very specifically what's going on in each individual vein, then we can come up with the operation to identify and help those specific veins. Now, historically, the sutureless repair was created to help patients with pulmonary vein stenosis. What we've learned is that a sutureless repair doesn't really always fix the problem for pulmonary vein stenosis. So we've created a different type of operation, which we call the anatomically based repair, to fix the anatomic problem. And once we fix the anatomic problem or take the obstruction away, we create the environment for the blood flow to return from the lungs to the heart in an unobstructed fashion. We try to make the pulmonary veins look normal, because frequently the reason the pulmonary veins have disease is because they're in an abnormal position. So if we anatomically correct them and make them look normal, then it takes away the nidus that has caused the pulmonary vein obstruction in the first place.